Our guest today is a nurse practitioner in the South Florida area that specializes in aesthetics. Please help me to introduce family nurse practitioner Livia.
Livia Manner, nurse practitioner, specializing only in medical aesthetics. I have been in this business for over 10 years. Aesthetics, all I do, I'm 100% dedicated to this field, and I just love it.
Nice. Hi, my name is Jonathan McLean, and I'm the founder and CEO of McLean Aesthetics.
Welcome to the dark side.
Let's go. Hey, Livia, thank you for joining me today.
Thank you for coming.
No worries, no worries. I'm so excited. Your office looks amazing here.
Thank you. I appreciate that.
No worries. So I wanted to go right into it. Tell me, how did you get started in the aesthetic industry?
I worked in many aesthetic businesses as a clinician and as a professor. And I developed my own aesthetic protocols, exclusive protocols based in existing injection techniques. For instance, blooming bat lift is a non-surgical Brazilian bat lift that I created.
Wow, that's so interesting. What made you want to do that? I know we're in the South Florida market. Is it because it's so popular down here?
It definitely is. Brazilian bat lift originated in Brazil by Dr. Pitangui, and the surgical one I'm talking about, and now it is just all over the world. But because of the downtime related to surgery, we came out with new alternatives that we call non-surgical Brazilian bat lift. And it can be done with different products such as radius, sculpture, and you name. So I created my own in which I combine different products to volumize the buttocks, to give a lift, and then to have that silky, smooth ending results to the skin.
Wow, that's very interesting. Like, I go to so many clinics, I see that popping up all over the place. I actually talked to an insurance company last week, and they said it's the most high risk type of procedure. Why is it so high risk by chance?
The surgical BBL is high risk because it involves fat transfer. That is when the plastic surgeon, he does a liposuction, he removes fat, and then he injects in the buttocks. That can create what is called fat emboli, and it can go, for example, to the lungs and create a pulmonary embolism. Some people die from this procedure. Because of this reason, we came out with new alternatives, the non-surgical. And that is what I do, only non-surgical procedures.
Nice, amazing, amazing.
Thank you.
So tell us, so how did you get from actually working for somebody to starting your own business? What was the path that you took for that?
I work in so many places and I have gratitude. I learned so much, all the experience I acquired over the years. And it got to a point that I knew enough to create my own exclusive protocols. And one of the reasons that I wanted to be alone is that I feel I'm an artist and my clients are like my muse. And when I'm working alone, I can pay more attention to the client, and that artistry part of me just flow the way better.
Yeah, and that's so good that you say that, because I always tell providers, it's not only you're being a provider, you're also an artistic person too. How important is it to kind of practice that artistic point, the artistic side?
For me, it is very important. I feel my clients are like my muse, and I need to have that time with them alone and to not have any interference from an assistant. If I need help, I can call my assistant, but I like that time between patient provider to develop trust and to pay attention to how they communicate, their facial expressions. So I'm completely devoted to my client when I'm taking care of them. And then I can see some expression lines in some movements that otherwise, if there were more people around and talking, perhaps I wouldn't see it, and provide the very best care and make them to look and feel their very best.
And that's an extreme good point. That's like the white glove service, really analyzing what's going on instead of just like a factory setting where it's just one after the other, after the other, after the other. So
Yes.
I can totally understand that for sure.
Yes.
Now I want to talk about the non-surgical BBL a little bit more.
Okay.
Now, behind the scenes, we're talking about surgery versus non-surgery. If a client comes in and they want maybe like, I know you can't get the same outcomes as surgery, but they want something similar, what do you recommend as far as like how many syringes they may need or things of that nature?
When the client comes for a consultation, I always ask them to bring a picture of how they used to be, or if they wanted to go back on time, or a picture of somebody else that have the shape, the size that they are looking for. And then I analyze to see how many products I'm gonna need, how many sessions, and what technique I'm gonna use to address their problems. Sometimes they need volume, other times lifting, and other times mostly about retexturing the skin.
Nice, nice. And that's a good point that you just made there because you're actually giving them one-on-one hands-on walking them through the process of the real expectations that they may face. A lot of times I feel like, you know, people just go into these offices, they don't know the expectations and they come back and be like, I didn't get the results I wanted. You know, I'm mad now. I'm going to write a review or things of that nature. How do you kind of manage those reviews and things of that in this industry?
One of the hardest part of the job is to set patients' expectations. So I always tell them that the product is gonna last up to whatever the research shows, up to 2 years. It may not be 2 years for the specific client, but over the years I did the procedure so many times that I kind of know that maybe it says up to 2 years, but in most people it really lasts in 1 year. So I am honest with the client and I tell that to them. But in some people it lasts a shorter period of time. So they need to make a decision. Is that really for you to do this procedure knowing this is the price and you're gonna need to be doing your maintenance always? So they have to decide if they wanted to proceed doing the procedure or not. Is that for them? Because some people say money is not an objection. I want the best results. I'm willing to come back as often as possible. I just do not want to have surgery. And I do whatever you recommend. So these are easy clients because I feel like an artist because I can open 4 types of products and I'm using different products to take care of that client. So I see better results than if I'm limited by the number of products, the number of syringes, and the type of product. Because if I can only open 2 syringes or 1, I don't have enough products and I only have 1 type or 2 types. So I'm limited in what I can do for that person.
Yeah, no, I definitely can understand that. And that makes a lot of sense. You know, you're really, I always say like practicing medicine, right? You guys are practicing medicine. So the more range, you know, and trust a client has in you, the more that you can develop those skills and develop what's going on and walk them through the journey.
Absolutely.
Yes, 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 yes. So I know you've been practicing in South Florida for a long time. How have things changed since then to now?
Since the pandemic,
I would say since you've like first started and with aesthetics to kind of now, what are some things that may have changed in the industry that you've seen, or how are things much different now than how it used to be?
the prices went down. People that used to do aesthetic procedure in the past, they were more like upper middle class, and you hardly heard about Botox in the past. And there was a period that was difficult to start a business because people thought, oh, Botox is botulinum, and it was an issue. And nowadays you see people even in their 20s, a lot of people in their 20s having Botox as a preventing aging product.
Yeah, no, I totally agree. Like the millennials are taking over when it comes to med spas and aesthetic industry as far as like getting procedures done. Like I did a video on Miami Beach to talk to about people about how to use aesthetics. Do they use aesthetics, things like that nature? And most of the people I've seen, or most people that came up to me were younger people, and they were like, I'm getting into it early to prevent it before it goes further. How big is prevention and things of that nature?
I believe there is a major that aesthetic procedure do prevent aging and postpone surgery for later on in life. Because when my mother was my age, she was having already plastic surgery. I don't think I need plastic surgery.
Yeah.
So we age better. Obviously, we all gonna age and die. It's normal process of life, but we can age slowly and more gracefully. And I have been receiving Botox since I was 28 years old. And when you compare me to my brothers and my cousins who do not do aesthetic procedure, who do not receive the procedures, even though I'm older, I look younger.
Yeah. Yeah. No, you do. You do look very young. And I think that's the goal, to start that backward process when you're at a prime age. So then when you do age, like when you do get older, you still look younger.
Absolutely. I really believe in aesthetic procedures. We age better, and I think that once we age better and we feel that we look good, our confidence go up and we do better in life.
Yeah, most definitely. Most definitely. I love it. I love it. So tell me a little bit about do you still practice regular traditional medicine, or do you still prescribe medication to your patients?
I am in the anti-aging field only.
Yeah.
So I do hormone replacement therapy. So I prescribe medication as far as the hormone to prevent aging, like as an anti-aging business, and aesthetics. 100% of the time dedicated to this field. A little bit of dermatology just because it overlaps with beauty of the skin. So I do a little dermatology. Not when the client have an infectious disease, but when client have skin problems like acne, hyperpigmentation, psoriasis, anything that I can improve the skin, then I do.
Nice, nice. Yes. Now, you talked a little bit about teaching before. How was that for you, and how did that impact your career?
It was a great experience. Mm-hmm. I think that when you teach, you learn as well. I met providers from all over the world that came to South Florida to a school I used to teach, the Aesthetic Skin Institute, and we communicate until today. So it's nice to be able to share knowledge with people who live in other countries.
Do you feel as though like different countries are ahead in aesthetics, and how do you learn so much to bring it back to America?
Korea is ahead when it comes to surgery.
Gotcha.
But they do some type of surgery that for our culture, it wouldn't work very well. Like they change the color of people's eyes and they become blind for 3 months, but then from black they get a blue eyes, but then you are blind for 3 months. I would never do that. I keep my black eyes. That in here it wouldn't be ethical, but they do a lot of surgical procedures. The US, we are big as well. US, Europe are big in aesthetics, and we do surgical and non-surgical. A lot of non-surgical.
Nice, nice. Yeah, I see them doing derma fillers all over the body now. Like you can literally get filler everywhere.
Yes, we do the PDO threads for knee lifting, the fillers for hands rejuvenation, neck rejuvenation. All these are becoming more popular because we all are more concerned about our face. We cannot hide our neck and knee, but people becoming more conscious that part of being beautiful is the whole body, not just the face. And they're starting to do other part of their body too. Sometimes the face is perfect and the neck's not, and the neck can give away their age or their hands. So they started to do other body parts as well.
I agree. I watch being in this industry. I mean, your eyesight becomes like my eyesight becomes 20/20 with a lot of different things. And I can see now that some people get their face done, but then their neck is like still not sped up to where their face is. So you can kind of see their aging and things of that nature.
Absolutely.
Nice.
So we're doing sculpture for the neck to retexture the skin, and PDO threads for lifting the neck.
Nice, nice.
Yes.
Now, everybody had to start in the industry from point A, you know, and I know you got your first job and you were in the industry ready to go. Is there any advice you can give to somebody that's trying to enter the industry and having a hard time, feeling like they're never going to get in?
Yes, I believe that education and practice are very important factors. And to read as many articles as possible, attend conferences, and if possible, to collaborate with other physicians in the same field.
Nice, nice. So everybody had to start from the beginning. Providers want to enter this industry every single day. New providers want to enter this industry. What are some tips you can give to somebody that may feel like I'll never get in, or some tips that they can do to get inside the industry?
Education and practice. After they get their degree, they can either be a doctor, a dentist, or a nurse practitioner, or a PA. Those are the 4 people that can practice non-surgical procedures in the state of Florida. Then they need to take courses. They need to get their certifications in Botox, derma fillers, Brazilian butt lift, whatever they wanted to practice. Normally, people started taking Botox courses. That is easier than fillers. It can get complicated. To review very well your anatomy, physiology, take courses from school that teach well, that are accredited, that you learn the right way to provide the services, not just rely on watching YouTube videos that sometimes is missing a portion of the procedure, and it can be very dangerous. Do not just go Googling and read whatever articles, but read articles that are research articles that have value, medical value.
Nice, nice. And I'm glad you said that, because anybody can make a course and things of that nature, but you really want to check out who that person is behind the course to make sure you're getting the most value, you know, and I totally agree with that. Tell us a little bit about, I know you talked a little bit about behind the scenes that you take webinars and you actually do trainings via the web. How do you feel like you get a lot of value out of that versus an in-person training?
I like in-person training a lot, but because of the pandemic and the difficulty in going to different places and not feeling like being exposed to the virus, but now things are getting better. I will be attending a conference with Dr. Darkin next week virtually. I chose this way. Also, I don't have to drive or waste time, and he's a plastic surgeon that I trust very much so.
Nice, nice. Do you feel as though new providers should really seek out a dermatologist or a plastic surgeon to learn from at first?
I think they have to learn from providers that specialize in non-surgical procedure if that was they are looking for. Because if you are a plastic surgeon, you may do well as a plastic surgeon, but what percentage of the time do you really utilize doing non-surgical procedure, which is 2 different type of procedures? So does the person teaching have to be a dermatologist or a plastic surgeon? Absolutely not. It has to be somebody specialized in the field of medical aesthetics who have experience and is dedicated to this field.
Great. Yeah, I couldn't said it more. And I was talking to another provider about that. Like, you really want to learn from somebody that's doing it all the time, that knows what can happen in case of emergency and things of that nature. I know you said you made your own protocols. Was that an important part for you?
Yes, it was. For me, it's important to differentiate myself from other providers, and by having so much experience, and I don't know how many thousands of different types of procedures over the years, and then I found out that certain ways work better than others, and creating my protocol is very important to me.
Nice, nice. Now let's talk branding. How important is it to brand yourself as an aesthetic provider?
It is very important to branding ourselves. Social media has a big impact on it. I believe that potential patients are more interested in knowing the provider in a deeper level than ever before.
Yeah.
They not just wanted to know the provider's professional level, but also the human side.
How do you know how to, I guess, give a balance? Like, do you share too much? Do you share enough? How do you kind of give that balance?
about sharing.
Like sharing your personal life, right? I know like that helps a lot of clients to come to you because they want to know you. They want to know how many dogs do you have. They want to know, where do you like to work out, things of that nature. But how do you know if it's too much sharing or if it's not enough?
I have a marketing person that she helps me out. Before, my social media was all about my work, and I hardly share anything about my professional life. And she said things has changed and the client wants to know who I am as a person, what I believe. And I started to share a little more about myself. They want to know where I go, places that I go, my belief system, how I dress, how I take care of myself. So I started to share some of it, but I do not share too much. For instance, she told me to show how healthy I am. I'm in good shape in a bikini. I took a picture and it looked great. And I asked her, are you sure I should do that? And she said, yes, that will be a controversy, but you should, because it's a way for you to show that you look amazing at your age and you look healthy. Then I had double thoughts about it. I showed my mother, and my mom is more conservative. And she said, I think that is a better way for you to show that you are in shape and you are healthy. And I agree with my mom, and I didn't feel comfortable using bikini. But I can still show that I am in shape without showing so much skin.
And I agree, you got to stick to your brand. Whatever the people that come to you, they want to know you, who you truly are, not like a fake version of you. Yes. So like if you're always hopping on the trends that are coming up or hopping on what's next, you're going to get lost in the industry. But if you're sticking to your brand, who you truly are, then everybody's going to feel like, okay, I can trust that provider and I want to be there.
I'm classic, and that is how I have always been. And I do not want to get into trends that I do not feel comfortable. Like the videos that they're doing now, that you dancing, moving. It can be fun, but yeah. I find it to be a little silly, and it doesn't fit my branding. So I'd rather be classic. I like to wear a lot of white in real life. And also when I'm working, I think white is a beautiful color. It's clean, hygiene. So I'd rather stay my way.
Yeah, no, I can definitely understand. What do you do? And I'm glad you spoke about that. What do you do if a patient maybe comes in and they want like an overfilled look or something that you're not comfortable performing?
Then I tell the client that I do not think it's going to look natural, is not a good look for the client. Sometimes they ask for procedures that are not even safe, like a fine line very close to the eyes. Mm-hmm. And I explained that it's not safe. I can help the skin under the eyes to look better, but we gotta be safe. There are some fine lines that we shouldn't play with because it is unsafe.
I agree, and that's amazing. I always try to fight for that, because if you're taking it too far just for the money, then it's gonna ruin the industry as a whole. I think really telling, customers, hey, this is unsafe, or I understand your concern, but this is what we have to do, and using your best judgment is amazing.
Thank you.
Yes.
Thank you.
Yes. Do you use Instagram by chance, or is that a big part of your business?
What?
Instagram?
Yes, I do use Instagram. I have a little more than 10,000 followers.
Wow, that's amazing.
I'm not sure if it's great or not, but it's all organic.
Wow.
And I do get some clients from Instagram.
That's great. Yeah, Instagram is one of the number one sources right now for media. So the fact that you built an organic audience over 10K, you got to think most providers aren't getting those numbers because of the smaller type of industry. So it's great that you keep building those numbers.
Thank you.
Yes, for sure. Is there any training or conferences that you recommend for providers to maybe try or go to?
Yes, I do. There is one here in Miami, the Miami Convention Center. They are having conferences annually, and there are good providers there teaching. I used to teach at the Aesthetic Skin Institute. It's a good place too. There is a colleague of mine, Dr. Herb, that he offers preceptorship programs in a one-to-one. I used to do that, but now I'm kind of busy, so I don't do as often. I may restart providing that as well.
Wow, that's amazing. I'm going to have to put that information below because so many people want to break into the industry. And I think there needs to be some type of residency or something for providers because, you know, when you go to school, there's no subspecialty to learn in school. So how can you really, you know, learn? You have to kind of take the leap and kind of try it out. But just to have like a residency that you can go to after, I think would be awesome.
Yes, because we don't have that yet, then that is why I always say read as many research articles as possible, get involved with the trend in aesthetics, attend conferences everywhere if you can in other countries as well, and collaborate with other providers in the field.
Yeah.
Read a lot.
You're only as good as the knowledge that you know. So always learning, always learning.
Yes, absolutely.
So I know you met so many people in the industry before. Who are some people that you can recommend for everybody to follow? It could be on Instagram. It could be somebody that you just know of, a doctor, a mid-level, anyone.
Nurse practitioner Herb is a very good one. He was my professor initially many years ago, and we do collaborate sometimes. Dr. Darking, I really like him, and he's a great provider. Dr. Faride is also great. She's in the aesthetic field as well. We collaborate as well.
Nice, nice, nice. Now, I wanted to go back, and I'm going to put those all below so everybody can check those people out because I'm sure they're going to add a lot of value to that.
Okay.
Yes. So I wanted to go back to the point you made about dermatology earlier. How closely is aesthetics and dermatology related? And do you feel like you need to study dermatology to be a great aesthetic provider?
Part of dermatology involves beauty, aesthetic, which is taking care of the skin, like teenagers with acne or hyperpigmentation from the sun or even after a disease or something. So that overlaps, and I do take care of those clients. But when it has to do with infectious disease of the skin, then yeah, of course, if you take care of that, it's going to improve the skin too, but that is more medical and the insurance is going to cover. And I rather do not take care of these clients because the insurance will cover why to pay out of your pocket. If your insurance is going to pay, it can become very expensive for the client. The other reason is this is a small practice and I like it to be small because it's more intimate. I'm closer to my clients. I like that relationship of connection between provider and patient. My clients appreciate that as well. So for me to take care of patients that come with some infectious disease, it can be contagious, and I rather keep my place very clean and only taking care of the aesthetic aspect.
Wow, that's some great information. Tell us a little bit about hormone replacement therapy. Now that has become a trend in South Florida and everybody's starting to hop on that wave now. How important is that for people that are aging?
It can be very important for like menopausal women. Sometimes they suffer a lot with hot flashes, like 20 hot flashes during the night. They do not sleep and they wake up. They are exhausted, frustrated, irritated. It can be very difficult to deal with these symptoms, and it happens with men also. With andropause, the energy level goes down. They don't have the same desire to work, to do things in life. So hormone replacement can be very important and help people to live a better life. They don't have to suffer, do not have energy, cannot do anything, cannot sleep. That is terrible. Not to be able to rest and sleep in the morning, you cannot work, you're exhausted. But it is not for everybody. It has to be safe.
Yeah.
So each client, we take the blood test, we do an assessment to make sure that they can benefit from hormone replacement without taking chances of the complications that it can occur.
Wow, wow. And I just learned about, I want to say not even a year ago, I really learned about HRT the most and has so many great benefits for, like you said, men and women. Now we are in your office right now, as I said. It looks amazing. Can you go ahead and tell us where are you located, what type of services that you offer, and who could come if interested?
I'm located in Hollywood, Florida, in 1940 Harrison Street, Hollywood, Florida, and I provide non-surgical procedures, everything about non-surgical procedures head to toe. And that includes, for example, lip augmentation, jawline definition, cheekbone augmentation, under eye treatments, eyebrow lift, hands rejuvenation, neck rejuvenation, sculpting the body with products to destroy fat cells. Wow. For the waist, love handles and abdomen, knee lift, varicose vein removal, hormone replacement, Brazilian butt lift, and much more.
Well, it's amazing. Definitely come. We're going to drop the address below so everyone can come and check it out, or definitely call you and set up an appointment if interested.
Thank you.
Yes, no worries, no worries. Now I want to talk about PDO since you mentioned that PDO thread. When you do like the knee lifting, a lot of providers have said PDO doesn't work really good on the body. Who would be a good candidate, I guess, for putting it in the body?
It would be somebody whose skin is starting to lose the laxities, like it's getting a little saggy, but it cannot be a severe case. In a severe case, then plastic surgery will be the best. And then the threads have to be designed for the body. The ones for the face is different. So we need bigger threads with bigger anchors for better holding.
Yeah, no, that's a good point. And what's the two different? I understand there's two different type of threads, correct? Like the sugar ones and then the barbed wire. Is that correct?
Yeah, there are different type of threads, PDO threads, and some they have the barbs, which is for lifting, and some is just to produce collagen and create the tightening effect. And they have like different shapes. So I use a combination of threads to get better results for lifting and tightening of the skin and retexturing of the skin as well. That way the client has better results.
Nice, nice. Yeah, I've learned so much about threads over the last couple of months, and where they're originated and things of that nature. That's why I love what you said about the global perspective, because threads originated from overseas, and some people have been doing them for years. So it's so interesting to see them done in the U.S. now.
Yes, the threads, I became certified in providing threads in 2015 when it was first FDA approved in the USA.
Wow.
But I did get my training in France as well. I was just preparing myself. I knew it was going to be FDA approved. So when it became, I got my certification here. So that's why I'm saying it is good to get training in other places as well. So when it comes to the US, then you are ahead the game.
That's super cool. You learning about the trends that are going to take over and being ahead of the market is really what puts you as an expert in the industry. What do you think the trends will be for the next couple of years in the industry?
I believe Brazilian butt lift is going to stay for quite a while, and that probably we're going to create new products specific for the BBL here in the US that I believe is going to be FDA approved. In other countries, they are already. I believe the US is going to be bringing something new.
Wow, I can't wait. I'd love to see it. Thank you so much for sitting down with me and talking about the aesthetic industry. Tell everybody where they can find you and what you have planned next.
You can find me in 1940 Harrison Street, Suite 308, Hollywood, Florida, USA.
And where's your give them your Instagram handles.
It is Livia Manner APRN, which is my name, Livia Manner APRN.
All right, awesome, awesome. And until next time, goodbye.
Bye, thank you.